Assalamu alaikum. Let's jump into adenomyosis. Adenomyosis is abnormal endometrial glands within the uterine myometrium. Risk factors: age more than 40, multiparity, prior uterine surgery, myomectomy. So, myomectomy, multiparity, age more than 40. There is dysmenorrhea, heavy menstrual bleeding, chronic pelvic pain, diffuse uterine enlargement, that is globular uterus, with or without uterine tenderness. Clinical diagnosis, clinical presentation, MRI and ultrasound, thickened endometrium, and confirmation via pathology. Treatment is hysterectomy. Treatment is hysterectomy. So, in case of adenomyosis, what would be its differential? Differential would be primary dysmenorrhea, endometriosis, and uterine fibroid. In primary dysmenorrhea, there may be painful mens, but patients typically have decreased pain by the 2 to 4 days of the menstrual period rather than throughout the entire menstruation. Like adenomyosis is very high yield thing you need to remember in case of differentiating. In what happens in case of diagnosis or dealing with the question, what we need is the DDs, primary or differential diagnosis. First differential diagnosis is primary dysmenorrhea. Primary dysmenorrhea. Okay, what is what happens in here? In here there is dysmenorrhea, painful menstruation, but decreased pain in the first 2 days of the menstrual period. Decreased pain in the first 2 days of the menstrual period rather than the entire mm, menstrual period, rather than the entire menstrual period, like adenomyosis. Another differential is endometriosis. How you can differentiate? Endometriosis again cause painful mens dysmenorrhea throughout the entire menstrual cycle, but because endometriosis is within the endometrial tissue outside the uterus, it does not cause diffusely enlarged boggy uterus. So in endometriosis, it does not cause diffusely enlarged boggy uterus. Like adenomyosis in uterine fibroid. So endometriosis is one of the differential, and the final word one is fibroid, uterine fibroid, also known as leiomyoma. Also known as leiomyoma. In leiomyoma, there is heavy, regular means, but painful means heavy, regular means fibroid can be distinguished from the adenomyosis either on pelvic examination, which can show irregularly enlarged uterus, or pelvic ultrasound, irregularly enlarged uterus on pelvic ultrasound, which shows the fibroid. So irregularly enlarged uterus or pelvic ultrasound which shows the fibroid. So in ultrasonography there is irregular, in pelvic examination there is irregularly enlarged uterus, and on pelvic ultrasound shows the fibroid. So that's how you can differentiate from adenomyosis from fibroid. So again, adenomyosis is an abnormal endometrial tissue within the myometrium. So In here there is dysmenorrhea, heavy menstrual pain, globular uterus, and with or without tenderness, with or without tenderness. And in clinical presentation, there is tender, boggy, symmetrically enlarged uterus. Tender, boggy, symmetrically enlarged uterus. The uterus does not typically exceed the size equivalent to that of the 12 weeks of gestation. And the diagnosis, MRI or ultrasound show thickened endomyometrium confirmation by pathology, and hysterectomy should be done. So that is all about adenomyosis. Hope you enjoyed.